Risk factors. The factors may raise the risk of breast cancer. A family history of breast cancer. If a parent, sibling, or child had breast cancer, your risk of developing it is enhanced. If your family has a history of early-onset breast cancer, your risk increases. Even so, the majority of breast cancer patients have no family history of the disease. Started your menstruation at an early age. Beginning your period before the age of 12 increases your risk of developing breast cancer. Menopause started at an older age. Beginning menopause after the age of 55 raises the risk of breast cancer. Being female. Women are far more likely than men to develop breast cancer. Everyone is born with some breast tissue, and anyone can develop breast cancer. Dense breast tissue. Breast tissue consists of both fatty and dense tissue. Milk glands, milk ducts, and fibrous tissue combine to form dense tissue. If you have dense breasts, the dense tissue outnumbers the fatty tissue. Dense breasts might make it difficult to detect breast cancer on a mammography. If a mammography reveals that you have thick breasts, your risk of breast cancer increases. Consult your healthcare provider about any tests you may need in addition to mammograms to detect breast cancer. Drinking alcohol. Drinking alcohol raises the chance of breast cancer. Having your first child at an advanced age. Giving birth to your first child after the age of May 30th raise your chance of breast cancer. Never been pregnant. Having been pregnant once or more reduces the chance of breast cancer. Never having been pregnant raises the risk. Rising age. The risk of developing breast cancer increases as you get older. Genetic DNA alterations that raise the risk of developing breast cancer. Some DNA variations that increase the risk of breast cancer can be handed down from parents to children. The most well-known mutations are named BRCA1 and BRCA2. These mutations can significantly increase your risk of breast cancer and other malignancies, although not everyone with these genetic abnormalities develops cancer. Menopausal hormone treatment. Taking certain hormone treatment medications to relieve menopausal symptoms may raise the risk of developing breast cancer. The risk is associated with hormone therapy medications that mix estrogen and progesterone. When you discontinue the use of these medications, your risk decreases. Obesity. People who are obese are more likely to develop breast cancer. Radioactive exposure. If you had radiation treatments to your chest as a kid or young adult, you are more likely to develop breast cancer. Things you can do to lower your risk of breast cancer. Making changes in your daily life may reduce your chance of breast cancer. Try this. Inquire about breast cancer screening. Consult your doctor or another healthcare professional about when to start breast cancer screening. Inquire about the benefits and hazards of screening. Together, you can select which breast cancer screening tests are best for you. Awareness. Breast self-exams might help you become more aware of your breasts. You can become acquainted with your breasts by performing a breast self-exam on a regular basis. If you notice a new change, a lump, or anything out of the ordinary in your breasts, contact a healthcare expert immediately. Breast cancer cannot be prevented just by breast awareness. However, it may help you better comprehend the appearance and feel of your breasts. This may increase your chances of noticing any changes. Consume alcohol in moderation, if at all. If you prefer to drink alcohol, limit your intake to 1 drink per day. There is no such thing as a safe amount of alcohol to prevent breast cancer. So, if you're concerned about your risk of developing breast cancer, you might avoid drinking alcohol. Exercise regularly most days of the week. Aim for 30 minutes of exercise on most days of the week. If you haven't been active in a while, ask your doctor if it's okay to start slowly. Limit menopausal hormone treatment. Combination hormone therapy may raise the risk of breast cancer. Consult a healthcare practitioner about the benefits and hazards of hormone therapy. To lower the risk of breast cancer, use the lowest possible dose of hormone therapy for the shortest period of time. Maintain a healthy body weight. If your weight is healthy, strive to maintain it. If you need to lose weight, consult a healthcare expert about healthy options. Reduce your calorie intake while gradually increasing your physical activity.